Sorry
Good.
for the little delay there. We're having it's just been a really fun morning. Maddie, unfortunately there was a car accident at the end of her street, so her power went out at the last minute. So I hopped on a little bit late to get our guest speaker set up. So we apologize for the delay here.
Yes.
No problem.
So, hey everybody, welcome, welcome. A little bit of tech issues this morning or this afternoon, depending on where you are. But we are going to go ahead and get started.
I haven't received the presentation yet.
Okay. All right. I'm going to go ahead and share my screen and we are going to jump right in. Can somebody give me a thumbs up to let me know if you are actually seeing my presentation? Yes? All right, perfect. So I'm not going to be able to see you for a moment. So Mary will be graciously assisting me with your questions. There will be time for Q&A at the end, but please feel free to share your questions or comments in the chat and I will get to them towards the end of our presentation. So with that said, I'm so happy that you're here. I'm a little disappointed that I was not able to present this to you all during the annual meeting last month. The powers that be and the airlines just were not in my favor that day, but I'm excited that you're here today to receive this presentation. And I really look forward to sharing this information with you and having an engaging time where you give me your feedback. Let me know what you think. Ask those questions. No question is too difficult. If I don't have an answer, I'll be sure to find one for you. So with that said, let's go ahead and get started. Today's presentation is titled Reducing Barriers to Healthcare Access for Underserved Populations Through Telemedicine. This was the original presentation that was prepared for the Tennessee Charitable Care Network annual conference back in September. The beautiful face that you see right here, I promise you it is me. I'm Asiyah. I'm Asiyah Franklin. I work for DoxyMe as a Senior Telemedicine Success Manager. My background is in nursing, more specifically women's health nursing, as well as public health research. I have been in this industry for over 20 years, and I really have developed a love for bridging technology with healthcare delivery, particularly in community-based healthcare settings. Right now, I'm coming to you from beautiful Brooklyn, New York. However, I have lived in Georgia and Tennessee and South Dakota and so many other places where I've had the opportunity to work with people in rural healthcare and suburban healthcare, and here in New York, urban healthcare. So I have a unique position and understanding of what it's like to serve marginalized and historically disenfranchised populations, and what we need to do to build trust with them in those community-based healthcare settings as healthcare providers to really help improve their health outcomes. So let's get into this. As someone who is really passionate about equitable healthcare, this presentation is close to me, so I'm really excited to bring it to you. So equitable access is quality healthcare, and it's our responsibility as healthcare providers, no matter what geographic location we're in, whatever the population is that we are serving, creating equitable access to quality healthcare is ultimately our responsibility. We can do this through access and breaking down barriers to quality and sustainable healthcare, specifically in historically underserved populations. When we get a little further into the presentation, I'm going to give you some examples of what those historically underserved populations are, because many times when we hear that phrase, historically underserved, we tend to go to race or ethnicity. And while that is one of the populations that we know are marginalized, it is not the end all be all. Today, I'm really excited to share with you innovative approaches, or one specific innovative approach to improving access and healthcare delivery, particularly within those populations that experience health disparities related to healthcare accessibility issues. With many of you joining from the great state of Tennessee, some of you are probably in areas that are rural, that have access issues, whether it's due to transportation or confinement. And the solution that I'm going to share with you today, or the approach that I'm going to share with you today, can help you reach those populations and really help them improve their health outcomes. So let's talk about the issue. There are barriers to healthcare access and equity that are closely linked to the social determinants of health. And as healthcare providers, we all know what the social determinants of health are and how they impact not just access, but outcomes. And they create inequitable healthcare spaces for the people that we serve. Those that are most affected are those historically disenfranchised and vulnerable populations that
Oh, Asiyah, I think you're muted.
Oh, no, it still says muted. Yeah, we're not able to hear you.
Can you hear me now?
Yep.
Yes.
Yes. Okay. I don't know how I got muted, but let's go ahead and get back into it. All right. So we were talking about the aging and how a lot of our population is aging. So if you are in primary care, or if you work in geriatrics or gerontology, you are dealing with a very significant portion of our population that we consider disenfranchised and vulnerable, as well as being marginalized. Rurality, we just touched on that topic. Being in rural areas definitely presents a host of issues to access and equity. Racial and ethnic minorities, that is usually the banner when we talk about access and equity and poor health outcomes. So I really won't dive too deep into that one. The disabled population, people who have access or limited access to sustainable transportation. Even educational attainment. So those with lower levels of educational attainment might not have the health literacy that they need to understand how to create systems for continuity of care, how to access the healthcare they need beyond what's right in front of them, such as their primary care or their pediatricians for children. Employment, people who are unemployed or underemployed, those who are uninsured or underinsured, which a lot of times connects directly to the type of employment that they have. People with mental health issues. We know that the spectrum of mental health issues is very broad, and health outcomes, physical health outcomes related to mental health is something that we also need to consider and address when we talk about disenfranchised and vulnerable populations. Language barriers, and that's one of the things that I really love about DoxyMe, and I'll share that with you as we get a little further into this presentation. But those language barriers, if you serve a non-English speaking population, or even if you would like to, those are ways for you to expand upon healthcare delivery in ways that you might not have before, while still addressing this population as a disenfranchised or vulnerable population. Minorities, all types of minorities, including those that identify as LGBTQIA+ or queer, and anybody else who falls outside of the majority. So the issue, as we continue exploring the issue, we've touched on some of the populations that we consider disenfranchised, that have issues with access and equity in healthcare. But as we expound upon the issue, it's important to note that about 50% of the US population is considered disenfranchised and vulnerable. So no matter your specialty, no matter what area of healthcare or medicine or mental health you are in, there is a great possibility that you are serving a part of the population who has poor outcomes related to them being a member of this segment that we consider disenfranchised and vulnerable. So these underserved populations often lack equal access to healthcare, and there are grave consequences, such as higher morbidity and mortality rates, higher medical costs, and lack of access to treatment. Now, we could probably go down a whole rabbit hole of what those higher medical costs are and how they are disproportionately divided among the disenfranchised and vulnerable individuals within our patient population, but we'll save that topic for another webinar. So moving forward, lack of access to treatment. That's why we're here today. How to create more access to the healthcare services that the people within our communities need, regardless of where you are in the country. So knowing this, we know that this is a public health concern with widespread health issues, and it impacts millions. If we had to put a number to 50% of the US population, I'm sure all of us would be stunned, astonished when we actually put a numerical number to that, because it is in the millions. And that's how many people are suffering physically and mentally because they don't have access. So let's get into what our role is as providers. As I mentioned in the beginning, I am a nurse through and through. So I always consider myself in this when I say our role, because I'm speaking from a place of understanding and professionalism as well. One way that we can increase this access for our patients to have better outcomes is through increasing our cultural competency. You might also hear this referred to as cultural proficiency. They're both used interchangeably, but they pretty much mean the same thing. Becoming, gaining an understanding, I don't want to say becoming, but gaining an understanding of the populations that we serve and the cultural nuances that are present within that population. If you are serving non-English speaking migrants, that culture and that understanding and their needs, their healthcare needs, are going to be vastly different from American-born, middle America farmers. So understanding the culture of the population that you serve and meeting them where they are by respecting and honoring their culture is what we call cultural competency or cultural proficiency. We also want to understand the unique needs of the population we serve. If you are in an urban setting, so let's say you're in Nashville, the population that you serve in Nashville is going to be gravely different than the population that would be served in, let's say, Bowling Green, Kentucky, or Minot, North Dakota, because completely different cultures, populations, health needs. So understanding the population that you serve really is a part of our role as providers. We also want to create better opportunities for healthcare access and delivery. That could look like increasing patient education, building relationships with stakeholders within your community, religious and community stakeholders, the people in your community, finding out what they need and then creating ways to deliver what they need. We also want to widen the framework of how we think about accessibility. I'm guilty of this, and maybe some of you have experienced this as well. Sometimes when we think of accessibility, we automatically go to those who have physical disabilities or physical concerns that might create physical barriers to accessing healthcare. But there are a host of barriers that are present, whether they be lack of health literacy, transportation, rurality, even being in an urban setting, language barriers. The list goes on and on. So by widening our frame of how we think about accessibility, we can increase our cultural competency, meet their unique needs, and create better healthcare access and delivery for that population. And then finally, our role is to understand that research is ever changing. It is not the same today as it was 2 or 3 or even 5 years ago. So understanding what the trends are and innovations in your area of specialty, as well as in public health, because we know public health and healthcare work hand in hand. We feed each other. And then identify predictions for the future. What can you do as a provider, as a healthcare practitioner, to prepare yourself for where humanity is moving, for where healthcare is going? And by understanding that and staying on top of those trends and using innovative features like what I'm going to share with you in just a moment here, this is a part of our role to really help improve our patients' health outcomes. So let's talk about the future of health equity. We've talked about what the issue is, who the most vulnerable are, what our role is, but let's talk about how we can move towards the future. It's one thing to acknowledge who needs the help and what they need help with, but if there is not a plan, if there is no direction, if we haven't created a journey map for how to help them improve, then what are we doing, right? We're just having a conversation. We're not planning. So understanding the future of health equity is really important to increasing accessibility and ultimately helping our patients thrive in health and wellness. So the future of health equity is twofold. First, it's rooted in innovative tools and techniques. So non-clinical care delivery is an innovative tool. As I mentioned earlier, patient education, group offerings, doing assessments, whether they're in person or in a virtual setting, and then reviewing the results, having conversations with your patients. Clinical interventions. We all have heard of remote patient monitoring and the amazing things that are helping us help our patients with the use of remote patient monitoring. Virtual check-ins. Sometimes it's not feasible for us as providers to see an abundance of patients in person throughout the day, but we or someone on our team who has the skill set necessary may be able to do those virtual check-ins. So in the interim between those in-person visits, we know what's going on with our patients. We can shift and help them manage their medical issues, health concerns, mental health issues, while using things that we probably didn't have a few years ago. The other side of the future of health equity is increased accessibility. Using telehealth and telemedicine is one. Survey your patient populations to better understand their needs. And this is a really big one, building those relationships with the stakeholders, the people in your community. The people in your community are those that you serve. Maybe you are a specialist and you have people come in from outside of your community, but many of us serve the people in the communities where we live, work, and play. So surveying those patient populations and understanding what their needs are. Let them tell us what their needs are instead of us making assumptions about what we think their needs are. This helps us move towards the future of health equity, ensuring that everybody has access to the same level and quality of care, regardless of where they live, how they identify, their race or their ethnicity, disability status. Everybody should have the same access. And then we also want to collaborate with our local and regional organizations and departments of health. And many of you here are already doing that because you're members of TCCN. So you are already collaborating. You understand the power of collaboration. But take it a step further if you haven't already. See what your other regional organizations are available to you within your specialty, or are that focused specifically on health equity or health disparities. And then, of course, your departments of health. The Department of Health within your county or within your state is a wealth of information and resources. And I can't advocate enough for us as healthcare providers to build those relationships with the multiple layers of stakeholders within our communities, including those departments of health, because this is going to help us move towards those positive outcomes that we want and ultimately do exactly what we got into healthcare for, to help people, to save people, to give them better quality of life. So now that I've given you a grand history, let's talk about telehealth. Many of you are probably already using telehealth solutions, or you might be wondering, how can you change what you're doing in telehealth to increase health equity within your community and beyond? Because as we know, telehealth, there are no boundaries. You can reach people anywhere, given the rules and regulations with insurance and state laws, right? But again, that's a time and place. There's a time and place for that conversation. So telehealth is a viable solution to improve healthcare accessibility and equity. And I'm going to give you a few reasons why. First, it reduces those traditional barriers to access, limiting challenges to quality healthcare. So I've touched on transportation, funding, in personal funds, unemployment, underemployment, insurance. Some of those are the traditional barriers, or all of those are the traditional barriers to access. So by utilizing telehealth as a way to deliver healthcare, we are reducing some of those barriers and giving the people in our communities, the people that we care for, who we want to see thrive, opportunities to build their, what I like to call, wellness portfolio, because it's not just one aspect. There are many levels and many components to being well or wealthy, a combination of wellness and health. We also can use telehealth to support the provision of healthcare services. So this is important when we talk about how do we support the provision of healthcare services. I'm not sure who's on the call today and what your specialties are, but I think it's probably a fair assumption to say not everybody on this call is providing direct health care services or healthcare delivery. There might be people who are doing administrative tasks, or people who are in the research space, who are in health education and programming. We can take all of that and throw it into this basket, this bucket called telehealth and telemedicine, and use that to support healthcare services and healthcare delivery. Telehealth is equally as effective as in-person care in some specialties. And I highlight some specialties because I don't want it to come across as telehealth is the replacement for in-person visits, because it's not. It's an addition to, it's another option. And it can be equally as effective. In a recent study within the maternal child health space, or women's health, not maternal child health, women's health, some women who responded to the survey shared that they would rather have their interim women's health visits with their provider via telehealth, meaning that if they were not coming in for their bimanual exam, for their pap smears, or the breast exams, that they just wanted to have a conversation. Maybe they needed to get a refill on something such as birth control, or they had questions about breastfeeding in the maternal health space. It's effective. We want to increase our patients' comfort and satisfaction, and we can do that through telehealth. It's amazing how comfortable someone will be in their own environment. We've all heard of white coat syndrome. I remember it was one of the first things that I learned when I started learning how to take blood pressures in nursing school 2 decades ago. When somebody is in their home environment, they have a different energy. And sometimes it's really useful for us as healthcare providers to see them in their home environment, because it allows us to see how they function in the day-to-day, and it gives us a true representation of their health, or things that might be confounding upon their health within their environment. I won't say embraces the benefits of the home environment, because I put those last 2 bullets into one. We can also use telehealth for primary care and chronic care management. Can it replace in-person visits completely? No, but it can help to support. And then we can use it also for additional assessments such as neuro, PT, OT, or allergy. A lot of the assessments that are done that don't require hands-on, any sort of manual assessments can be done using telehealth. And then the last thing is there are no geographic constraints, giving us a wider provider reach and the benefits of compact licensing. So as a nurse, I have a compact license, which allows me to practice, I believe, in 24 states without having to get a state-specific license. I know in the mental health space, licensed psychologists have also just entered into a compact compact licensing agreement, which allows them to provide care through telehealth to people in multiple states. And there are several other healthcare specialties that are now adopting this model. So through the use of telehealth, you can provide care to people outside of your geographic area. Let's talk about what the evidence says about telehealth, because I can give you my opinion and my experience, but as a healthcare professional and a public health researcher, it's important for me to understand what the evidence says. Is this something that is really viable? And if it is, how is it viable? So let's get into it. It's efficient, it's cost effective for providers and for patients. And you're probably saying right now, well, Asiyah, there's been a lot of change with reimbursement for telehealth. And yes, there has been a lot of change now that the public health emergency has come to an end. So I would encourage you to find out what the regulations are within your state, as well as with the insurance companies that you are a part of for your reimbursements, just to see what's going on and how it can impact you. But overall, telehealth is still very efficient and cost effective. It creates a direct connection for those in historically underserved communities. We touched on who those people are and how many of them there are in our communities. So if you think of something like Meals on Wheels or Doctors Abroad, anybody who's going into physically going into communities that have a need. This gives us a way to duplicate that or duplicate efforts such as those using telehealth. It's convenient and it reduces patient stress. We talked about white coat syndrome and how people's blood pressure shoots up sometimes when they go into doctors' offices just because they are nervous. Allowing them to stay in their homes is not only convenient for them, think of the aging, the elderly population, but it also reduces their stress, which can help with their overall health and well-being. 76% of US hospitals use telemedicine to connect with patients. 76%. This is accurate as of last year. 76%. And I keep honing in on 76% because it's important for us to realize that this is not something that is here today and gone tomorrow. This is a staple in healthcare delivery. This is a staple in reducing barriers to access. Telehealth is a staple in health equity and healthcare accessibility. 76% of US hospitals are using this to connect with their patients. It also increases communication between healthcare professionals. I've been homing in on how we can use this to build relationship and trust with our patients, but we can also use this with our fellow healthcare professionals, whether it's to do consults, check-ins, trainings. We can use telehealth in that way as well. Telemedicine supports family-centered care. So I always tend to think, and this might have something to do with my women's health background, as women as the matriarchs, as the leaders of not just our families, but also our communities as well. And when we are able to connect with women, with females, it helps us to build a community of family and bring that family-centered care together. So building those relationships, helping our matriarchs through telemedicine also allows us to help their families through telemedicine, whether it's their spouse, their children, it could even be their pets, because telehealth or televeterinary health is a thing as well if we have any veterinarians here or animal care providers. It also promotes work-life balance for us as healthcare workers. Throughout this COVID, because we're no longer in the pandemic, but throughout the pandemic, burnout was something that was all over everybody's radar, whether you experienced it personally or someone within your circle experienced it. Burnout is real. It's still very real, and it has been real for a very long time for us as healthcare providers. But using telehealth can help to promote a work-life balance because, again, it gives us an opportunity to either provide care from the comfort of our homes or our safe spaces, whether that be our office or someplace else that is quiet, and of course, HIPAA compliant. We don't want to forget that. But it gives us an opportunity to delve into what it feels like to have work-life balance. And then lastly, it removes barriers to care. I touched on this just a while ago. Telehealth has a great potential to reduce health inequities. Health inequities are largely due to the social determinants of health, and one of those is health access. So by utilizing telehealth, we are reducing and sometimes even mitigating those barriers by allowing access, and by allowing access, we can improve outcomes and find health equity within our communities and move away from those health inequities. So you're thinking, okay, this is great. Asiyah, you just told me what my role is and shared some other things with me, but how can I help to increase telehealth uptake in my community? What can I do as an individual or as a part of a health system or a medical practice? What can I do? Well, understand telehealth uses and envision the benefits that your patient population will receive by utilizing telehealth. You also want to use a platform that is built upon the mission of health equity, accessibility, and ease. As we all know, there are several platforms available to us that we can use for telehealth and telemedicine. And I encourage you, I actually implore you to look into the company that you are using. What's their mission? What's their vision? What are they built upon? Are they just helping you deliver virtual care, or are they helping you be a leader within the health equity space? Are they helping you to really improve your patients' outcomes? What are they helping you to do? Your role is also to identify potential issues. Issues can be anywhere, but I'm going to focus primarily on rural areas because I do know that we have some rural healthcare providers here with us. Do you have broadband in your area? Is there internet broadband in the area so that your patients can actually use telehealth? If you're offering it, but your patients can't access it, then that is still a barrier. Patient reception. If you're dealing with maybe an aging population who might not be as comfortable with digital devices, how would they receive you beginning to offer or increasing your offerings of telehealth? And then also noting that portions of your workflow can be conducted via telehealth. So it could be things like intake or discharge, nursing education, surgical assessments, things like that can be done via telehealth. So by incorporating these into your practice or into your medical system, you are helping to increase telehealth uptake in your community. And then lastly, involve your staff, your patients, and other stakeholders. I touched on this a little bit ago when I spoke about getting involved with your religious leaders, your community leaders, the patients in your communities. Town hall meetings are a great way to do this. Surveys are a great way to do this. Just having your staff ask your patients questions when they come in for a visit, or you, if you have time as a provider, to ask them questions. This is a great way to get that information so that you know what the needs are and you can infuse that into your practice to increase telehealth uptake in your community. We're wrapping up. I promise we're wrapping up. I know I've said a lot. So I want to introduce to you DoxyMe. And I know some of you are already using DoxyMe, and I love that for you. But for those who don't know about DoxyMe, who want to learn about a organization, a brand, a family that is really here to move humanity forward, I'm going to share some things with you. We are the world's most loved telemedicine solution. I promise you, we really, really are. We began as a solution to improve rural maternal health care access. So I heard something not too long ago that said there are tech companies that are in healthcare, and then you have health tech companies. And we are a health tech company because we are grounded. Our fundamentals, our foundation is rooted in care. We also have our telemedicine success managers, such as myself, who are all healthcare professionals, and we utilize our expertise to aid our providers in delivering top quality care. In addition to that, we have an in-house research team that has published, and will continue to publish studies, not just on telemedicine, but in telemedicine adjacent fields as well, such as health equity. We also provide an ease of use for our clinicians and our patients. There are no downloads, there are no meeting IDs or passwords. It's simply clicking on a link. So essentially, anybody can use our platform without some of the barriers that may be present when using other telehealth platforms. And this is a really big one, this next one. We're HIPAA compliant. And we have enterprise-grade security built into the platform. So you know that when you're using our platform, not only are you using a platform that's built on the fundamentals of healthcare accessibility, equity, and delivery, but that your interaction with your patients is going to be safe and secure. And then, because we want to make sure that everybody has access, we have free and paid solutions within our platform, because we don't want to create a barrier to access. Again, we are all about health equity, accessibility, and by having a free solution for those that need it ensures that we can stick to our fundamentals and our mission and vision, and that we can help our patients receive the care they need. So I like to say, as a final word, we are the change makers in healthcare. We're equipped with the knowledge necessary to improve the health outcomes of those in our communities. So by committing to using technology to improve health equity, improve outcomes, and restore quality of life to those whose care we are charged with, is really important. I know that everyone that's on this call is dedicated to improving our patients' outcomes, to increasing access, and to finding some sort of balance in health equity. If you weren't, you wouldn't be here. So use technology. There are many innovations that are available to us, including telehealth. Let's have a discussion, an ongoing discussion about how we can use technology within our communities. So I'm going to stop here, and I'm going to see if we have any questions or comments or testimonials from anybody that is using DoxyMe or other technology. This is a time for us to have a conversation for the next few moments.
We do have one question in the chat. Can DoxyMe accommodate a hearing impaired or non-English speaking patient, and how does that work?
Yes, we absolutely can. So, and I'm going to exit here and stop sharing so that I can come back to you all and I can see your faces. So yes, we absolutely can. To answer both questions, we utilize something called Voice, and Voice is our language interpretation service, which does include ASL for the hearing impaired, as well as over 240 languages and dialects that are most are accessible within 30 seconds or less. So there's a good chance that no matter what language your patients or your population speaks, we have access to an interpreter who can assist them. I will add that our interpreters are medically trained. They are HIPAA compliant, so you can ensure that when they are interpreting for you, that it is accurate information. So I hope that answered the question. Dr. Rhonda, is it a three-way video call? So it is a video call. It's typically between you and your patient, but we have a group call feature as well, where you can have up to 12 people on a call at one time. So this is great for treatment plans, having family members or other providers on the call with you, up to 12 people, and that is including the presenter. And it works similar to any other video platform. When you sign in as a provider on your dashboard, you will see when your patients pop in, and then you can initiate the call with them. They will see you and you will see them.
So is it an extra charge for voice, or that's embedded? Like if we have our own translation video service, do we have to get them in on the call, or do we use yours embedded? Do you get what I mean in the question?
I get your question now. So I'll answer that in two parts. You can continue to use whoever your interpreter is at the time. You would have to bring them into the call. Some providers would do that just through audio. If you are using the voice interpreter, it is built into the platform. They will pop up on the screen to do the interpreting, and that is an additional charge per use. That's not included with the monthly or annual subscription to the DoxyMe platform. Did that answer your question, Dr. Rhonda?
It did, thank you. And we used it during the pandemic. We used Doxy.me, and it was very, very helpful. It'd be really nice if it embedded into our EMR, so we didn't have to like redocument everything. But
What
other than
EMR?
that, it was great. Dentrix Enterprise.
So we don't integrate with them, unfortunately. But one of the things that I appreciate about having conversations like this is that it allows me to see what you guys need and what you want. And I can take this information back to our product team. They're always innovating and developing, and integration is something that is very high on our radar. So when that time comes, because I'm going to say when, because I believe in a glass always being half full, I will definitely share that information with TCCN so they can pass it on.
Yeah. So we use the free version. In your paid versions, we're all charities on the call so that you understand. So cost is a big deal. So for any of us buying a paid version of Doxy, what would be the additional features that we would have?
Well, how much time do you have? Because there's lots of additional features for you. But what I will say, as a TCCN member, we have created a partnership that allows you to have a discounted rate for access to our paid features. So depending on if you do an annual or a monthly subscription, you could save 35 to 50% off. If you want to learn more about that, I'll be sure to share a QR code that you can scan and schedule an appointment with someone on our team. But while we're here, I will say some of the features that you'll have is screen sharing, group call, file transfer, access to the interpreter services. We also have, oh my goodness, Brian, Craig, help me out here. I feel like I'm running into, or Teely, feel like I'm running. There's so many features that are available to you on our paid platforms. Photo capture, payment capture. We have a lot of features that are available to you.
So the free feature doesn't have the language interpretation or the three-way calling.
For the interpreter?
Yeah.
Oh, Asiyah, I'll speak to that. So the free version does not. It's very basic, but the paid versions, and again, we have been working with NAFC to provide a discount for you. It would be voice is an additional 99 cents a minute for minutes used. So you're only paying for your minutes used. And you have the opportunity to choose between a male and a female interpreter at that time. And you'll be able to see, if you do want to meet with our team, we can show you most of the languages. You can pull on an interpreter within 30 seconds. So it's very quick. And then the group calls, you see that a lot with, depending on what you're treating, if adult children want to attend their parents' meetings, or a parent who is at work wants to join a pediatric meeting, you can host those types of calls. Or if you're even doing a therapy session, you can host up to 10 participants or 11 participants and the host of the call.
Did that answer your question, Dr. Rhonda?
Yes, thank you so much.
Awesome. Do we have any additional questions? No? Okay, I'm going to share one last thing with you. If anybody is interested in furthering this conversation with me or anyone on my team, I'm going to share a QR code with you that will make that possible. You can just scan it from your phone, and from there, you can jump on with us. Okay, So you should be seeing this in front of you now. This will take you to a landing page that was created specifically for this presentation. You can enter your information. Someone on the team will be able to connect with you to give you the information that you need. Or you can email me directly. That's my email address right there. It comes directly to me. I typically get back to email same day. So if something comes up for you after this presentation is over, if you have a question, if you want to just share something, or you want to learn more about our features, please feel free to email me or use the QR code to schedule a session. All right. Well, I thank everybody for attending. Mary, thank you for recording this. Please feel free to share it widely. And if you can send it to me as well, that would be great. I'm going to let everybody get some of their time back. I know we've been slotted for a whole hour, but I know you all are busy saving the world. So I'm going to let you get back to your day. And I look forward to connecting with all of you in some way in the future.
Thank you so much, Asiyah, for coming on and sharing this information with us. And thank you all for attending.
Absolutely. Have a great day, everyone.
Bye.
Bye.